there's a severe shortage of paramedics out there, and it's worse now with COVID because, you know, a lot of the medics have either come down with COVID or they have COVID-like symptoms, or they have to be in self-isolation in accordance to Toronto public health rules.
Toronto paramedics are sounding the alarm as the city's emergency services are pushed to the brink. A code red was declared by the city's local paramedic union on Twitter Saturday night, saying there were no units available just after 6:30.
There were no units available for a life-threatening call, and it's going to happen more often.
Both staffing shortages and the number of emergency calls have contributed to the strain, and yet city officials claim there's been no impact.
Our team continues to implement their respective mitigation plans effectively, thereby ensuring that these essential services continue to be delivered across the city.
Fire Chief Matthew Pegg has said that staffing has been an issue that they've had to deal with as well. He reported that both emergency and essential services had to deal with an unplanned absence rate of 13.7% on Wednesday this past week. Toronto officials acknowledging that responses by paramedics to low priority calls could be delayed, and that firefighters would respond if there's no clear indication of a patient or injury identified during the call-taking process. Paramedic Services has actually been making efforts to try and let the public know not to call 911 for minor health issues, including mild cough, cold, or flu symptoms. Over the course of the last week, the unions for both Peel and Durham region paramedics have made it known that their resources have also been stretched to the limit as well.
The workload is just increasing so much mental and physical strain on our members right now. And hearing those code zeros over the air when the paramedics are already on calls helping other community members, it's hard.
Toronto's Paramedic Union says staffing has already been a long-time problem. And now, in the midst of the COVID Omicron surge, it's the difference between life and death.
You have to have surge capacity in an emergency system in the event that the big one hits. They haven't kept up with the growth. People die. That's what happens. People unfortunately die.
Mark McAllister, City News.